started. Thank you. All right. So good morning, everyone. My name is Ashley Espinoza. Feel free to call me Ash. My pronouns are she, her, hers, and I'm the Cal OES project manager with the Child Abuse Prevention Center. On behalf of the Coalition for Victims of Child Abuse, or CVCA, I'd like to warmly welcome you to today's CVCA Symposium. We're truly grateful that you've chosen to spend your morning with us. We know how full your schedules can be, and we sincerely appreciate the important work each of you do to support children, youth, young adults, and families and communities impacted by trauma, abuse, exploitation, and violence. For those who are going to be joining with us for the first time, I'd like to briefly share a little bit about who we are. The Child Abuse Prevention Center is a statewide organization dedicated to strengthening families and communities to help prevent child abuse and neglect before it happens. Through funding from the California Governor's Office of Emergency Services, also known as Cal OES, we coordinate CVCA, a statewide network that supports up to 32 child abuse treatment program organizations and partner agencies across California. As part of this work, CVCA provides training, technical assistance, and resources that help strengthen trauma-informed care for children, youth, and families impacted by abuse, violence, exploitation, and other forms of trauma. We also support the professional growth of therapists, clinicians, advocates, and other child-serving professionals by building knowledge, confidence, and evidence-informed culturally responsive practices that can be applied in communities throughout the state. Today's symposium reflects that commitment by focusing on a topic that continues to be a priority for many of our AT subrecipients. Supporting youth impacted by commercially sexually exploitation of children, or CSEC, requires specialized approaches that recognize the impact of trauma and unique barriers that these youth may be experiencing. We consistently heard that professionals are looking for practical strategies to build trust, strengthening engagement, and enhancing their ability to support youth impacted by trauma and exploitation. Today's training is designed to strengthen those skills by exploring harm reduction principles and survivor-centered approaches that can reduce barriers to engagement while supporting long-term healing and recovery. So before we get started, I just wanted to quickly review a few Zoom housekeeping items. First, please make sure your microphone stays muted unless you're speaking. This helps reduce background noise and keeps things clear for everybody. And feel free to use the chat in the chat box throughout our time together. Both will be monitored, so drop any questions or comments that come up. We encourage reflections and engagement, and we'll also reserve time at the end of the session for live Q&A with the speaker. We are also recording today's presentation for internal purposes. We'll be sharing the slides and recording with you afterwards. And lastly, you're welcome to use the Zoom features like raise the hand option and reactions. Please engage whatever feels most comfortable to you. We also invite you to be fully present during this training. Today's topic includes discussions of commercially sexually exploited youth and other potentially difficult subject matter. We recognize that this content may feel heavy at times, so if at any point you need to step away, please be kind to yourself and take the time you need. Your well-being comes first, and we encourage you to participate at the level that feels appropriate and supportive for you today. So it's my pleasure to introduce today's presenter, Nicole Klasey. Nicole is a licensed psychologist with extensive experience in commercially sexual exploitation of children, human trafficking, and trauma. Her work has focused on supporting youth and young adults impacted by exploitation while equipping professionals with the knowledge and skills to provide effective and compassionate care. She specializes in harm reduction, motivational interviewing, and stages of change model, helping providers better engage youth and support them in different stages of readiness for change. Nicole's work is also grounded in trauma-informed, survivor-centered approaches that emphasize building trust, reducing barriers to engagement, and meeting youth where they are in their recovery journey. In addition to her clinical expertise, Nicole serves as a trainer and consultant for therapists, victim advocates, and child-serving professionals. Throughout today's symposium, Nicole will share evidence-informed approaches for supporting commercially sexually exploited youth and young adults, providing practical insights that professionals can carry to their clinical and community-based work. So please give me a warm welcome to Nicole. I'm going to turn it over to you to get us started.
All right, well, thank you. Let me share my screen here. And let me say a few other things about me before we begin. And let me start with just taking just a moment to share how I started doing work with our kids who were trafficked. I feel like professionally I kind of grew up in residential care as I started working in residential care right out of undergrad. I wanted to do work with teens, and having a bachelor's, there's not too much you could do. And so started working in a group home and loved working with our foster youth in that setting. Spent many years working there after getting licensed, and still do a lot of training and consultation with residential programs now. So if you work in a or are associated with a residential program, I have a big place in my heart for you. But as I was doing work in residential care, at this time I was in LA County. And as we were starting to learn about trafficking, LA County Juvenile Probation was having this big push for providers in the county to learn about trafficking. And as we started to learn about the issue, we came to recognize these are kids that we have. We didn't have that language to say this was a kid who was trafficked or this was a kid who was commercially sexually exploited, because you don't know what you don't know. Now, at this point, we had already adopted a trauma-informed model, but working with trafficking specifically was brand new. And at the time, there were very few residential programs across the country that were specializing in working with folks who had been trafficked. And so, as I was reaching out to kind of ask questions, find out, what are you doing? What's working? What's not working? The feedback I was getting was folks had a lot of questions for me, and folks were kind of like, if you figure it out, please reach back out. And so I started to get more involved in some of the work that LA County was doing and ended up stepping away from doing direct service to do more work around trafficking, and spent many years doing work specifically around trafficking, getting to work with many wonderful providers who are doing direct care, also getting to meet so many powerful and wonderful young women and women who had some decades under their belt, who had histories of trafficking, to really hear from them about what they need, what they needed when it came to service provision, what would be important when it came to prevention as well as intervention. And so I have really, really appreciated that. Also, during my time doing a lot of work around trafficking, I was able to develop some of the training curriculums that are still being used in California now when it comes to training child welfare workers and folks who are associated with child welfare around trafficking, from kind of more basic kind of 101 trainings to more advanced ones such as this when it comes to applying harm reduction to folks who've been trafficked. As well as myself and a colleague, we managed a grant for, oh gosh, about 3-ish years, where we were training child welfare providers, and we had a team of clinicians and survivors who we would pair together, who would go train in counties throughout the state on how to apply the stages of change model with folks who had been trafficked. Also, have been able to do some supervision at a sexual assault center. And while I was there, we would occasionally work with some young women who were involved in the commercial sex industry or kind of on their way out. And so much of what we're going to talk about today is relevant not only for our youth and young adults who are trafficked, but also for those who are at risk. So hopefully you get a lot of takeaways today as we talk. Over the past 10-ish years have really been focused on training and education. So we provide trainings through Klasey Consulting, and we provide trainings on trauma, resilience, mental health, trafficking, substance use, parent engagement, and we've even started to offer some stuff in Spanish for folks who are doing services in Spanish to families. But that is a little bit about me. As we talk today, please use our chat button. If there's questions, something you would like to share, please feel free to type away. I will do my best to respond to everything. Ash and Sadie, you're going to help me if I miss anything, an important question that comes up, but please feel free to type away. At the end, we'll get folks connected with a copy of the slides. If you would like a copy of those for reference, we definitely can. Also, I feel like I have to give this disclaimer in addition to the ones Ash mentioned, because this came up when I was doing presenting at a conference on this topic. Someone came up afterwards and made a comment around, I didn't realize we were going to be talking about sex today. And so I just want to give that disclaimer. We are going to be talking about sex today as we talk about harm reduction and as we talk about how we could apply it to folks who've been trafficked. All right, with that, we are going to dive in. I always start and end trainings on this note. I'm just wanting us to pause for a moment and take a moment really to reflect and ask ourselves, how am I taking care of myself? As we do work and as we do work with folks who've experienced an insurmountable amount of trauma, it takes a toll on us. Now, sometimes we could have a whole other training when it comes to vicarious trauma. We don't have time for it today, so we are just going to acknowledge that happens to us and we experience it. And this is where, especially when we are working with harm reduction and we're working with folks who are engaged in risky behaviors and we care about them, we worry. And when we don't take care of ourselves, it really can start to take away from our enjoyment, doing things that help refill and refuel us. And one of the things that really has stuck with me over the years about us needing to do better as a system of intentionally taking care of us was some years ago when I was doing work with LA County Juvenile Probation. We did a series of focus groups with some of our kids in care and really focusing on our kids who were trafficked and in care and asking, kind of what do you need from us as providers? And what stood out to me was hearing how many times they talked about needing caregivers and needing providers to practice what we preach. Hearing them make comments like, how is so and so going to tell me to invest in myself? They need to look in the mirror. They don't invest in themselves. And would hear comment after comment about that around those lines. And it was really a slap in the face, in the sense of like, we really got to be practicing what we're teaching. And that's hard. And so, really want to just encourage us to make sure we take care of ourselves. Also, just to make sure, I feel like most folks are familiar with Zoom these days, but just in case folks aren't, also just want to invite folks into the chat to share what you have done today, not the past weekend, not what you have coming up over the future weekends. What have you done today so far to take care of you? So I want to invite folks in the chat to share what you've done today to take care of you. I will start off and I'm going to share a few things that come in the chat. It is raining outside for me, so I got to get on my Peloton and get a good ride in this morning and got in lots of snuggles with my daughter, getting some exercise, some coffee, some time with the dog in the sun, some meditation, lots of coffee, getting in some cuddles, having vacation inside the house. Love it. Ooh, getting to put on the fancy glasses. I love that. I put on mine this morning too. Listening to some music, even little things like watering the plants, taking some extra time this morning, using the fancy coffee glass. Love it. We got to love those favorites. Doing some breath work. Love it. So many things. I know I didn't read off everything. Doing some devotional time this morning, some time in prayer. And just, really want to encourage us to take a moment and as I'm talking, even just scan through that chat box and look at some of the ways folks are taking care of themselves. And if you were one who didn't get it in, you're not alone. But hopefully just looking at some of the array, when it comes to how we take care of ourselves, you get some ideas for how you can take care of you. As a reminder, as we talk, feel free to use that chat to ask questions, share, as we will be using it throughout our time. All right. As we talk about harm reduction, it is kind of self-explanatory in the name, in the sense that as we talk about harm reduction, we're really talking about engaging in behaviors to reduce the harm of it. And so that becomes really important. We want to help reduce harm, and that's our focus. Now, when we think about harm reduction, and we're going to get into this here in a moment, many times there's a lot of trepidation of like, ooh, I don't know if it's okay to, practice harm reduction because that kind of feels like we're encouraging or we're enabling the behavior. And we're going to spend some time talking about that here in the moment. But again, when we think about harm reduction, we're simply thinking about what are things that we do that can help reduce harm. And when we think about it, we see there are things we do in our daily lives that we might not necessarily think I'm practicing harm reduction right now, but we are. Some examples, when we get in the car and we put our seatbelt on, putting on that seatbelt doesn't guarantee I will survive if I get in a car crash, but we know it greatly increases my chances. In the chat, we have putting a fence around the pool. Absolutely, that's a great example. Wearing a football helmet, doesn't guarantee if you're playing football nothing bad's going to happen to you. But we know wearing that safety equipment greatly increases your chance of bad stuff not happening to you. Hand washing. COVID's a great example of that. Just think about all the videos we saw pop up on social media about the proper way and the proper time to wash your hands because there's a reason for it. We know washing our hands, it helps prevent the spread of germs. Sunglasses. It helps protect our eyes when we're outside. We brush our teeth. It helps prevent us having to go back to the dentist and do all the not so fun, dental work. Again, these are some things that we do each and every day that we're not thinking when I brush my teeth. I'm not thinking I'm practicing harm reduction right now as I brush my teeth, but I'm doing it. And so, want us just to think for a moment about what are some other strategies we use regularly where we practice harm reduction in our own lives. And yes, Mandy, we'll get folks a copy of the slides afterwards. So, what are some thoughts as to what might be some things we do throughout our day to day that helps reduce our risk? Wearing a life vest, another great example. Being out in the water, that makes a world of difference if your boat, floats away or whatnot. Drinking plenty of water, taking vitamins, stretching. Absolutely. Especially when we get a couple of years under the belt and all that stuff, stretching becomes even more important. Sunscreen, yes. Wearing a tool belt. What else? What are some other things that we do and again, thinking about what do we do to reduce the risk of harm? Any other things pop up or come to mind for folks? Doing yoga, eating healthy, eating healthier, taking medication as recommended, walking more, taking a break to walk after sitting too long, working out, going to therapy. Absolutely. All of these things are some things that we do, again, that help us. Sunscreen, um, drinking water, resting. Even things like, think about things like going to all the preventative healthcare things, doing our annual physicals, all of those things, those help prevent bad things happening to us. If something's going on, it helps them catch it as soon as possible. Holding onto the rails as I go up the stairs with lunch bags. Absolutely. Talking to others. All of these things again help reduce risk. And so when we think about harm reduction, we recognize it's not that foreign of a concept. Even though sometimes it is seen as this kind of taboo kind of topic, we recognize these are things that we do oftentimes. All right, so thinking about more kind of in social services and mental health, what are some ways harm reduction has been used? So, one is when we think about our unsheltered population. We used to see all these great programs come into play, and they had all these, wonderful programs built, and then they found we're not seeing the outcomes that we thought. Like we have these services for unsheltered people, but we don't see them graduating our programs. And that's where we've seen kind of this flip of this focus on housing first. Let's provide housing, no strings attached. And what they found is when they did, then folks were willing to engage in the other services, such as meeting with a case manager, going to therapy, for example, maybe meeting with a psychiatrist, etc. Also syringe access, and this can be some of these things specifically around drugs. And so harm reduction has really, where it started was really looking at folks who use drugs and how can we help them be as safe as possible. Now again, this is where kind of the pushback comes into play, where it can feel like, aren't we encouraging somebody if we're giving them a syringe, if we're teaching them what veins to use, what direction to point a needle when you insert it into your body? But the thing about it is, if somebody is going to be shooting themselves up with whatever it might be, I would want them to be as safe as possible until they stop using, if they get to that point of stopping. And so this is where things like safer consumption sites, which again can be very controversial because aren't we encouraging people to use if we're saying, hey, come here and use? But the idea behind safer consumption sites is the fact that you could come use whatever it might be, and there's trained staff to intervene. And so what we found with safer consumption sites, guess what? Folks aren't overdosing. When they're using on their own, overdose happens. Things like fentanyl testing strips. Fentanyl can be mixed in lots of stuff. And so when we have somebody who's actively using drugs, we could teach them how to test their supply to see, is what I'm using, does it have fentanyl in it? Even things like using condoms, lubricant. Also safety planning. So many of us use safety plans with clients. And why do we safety plan? We want to decrease the risky behaviors. Another one on here is Narcan. So as we think about folks in the opioid epidemic, this is where it becomes so powerful because we have folks who continue to use. But when they have access to these things, again, it helps them be as safe as possible.
Look, you're smart, you're cool, and you don't want to die, so you do things to reduce the harm of the risks you take. That's called harm reduction. It's all around us. Taxi. Harm reduction is common sense. It stops people from being injured and dying from things that are preventable. It saves lives, it saves money. It's smart. Here's a fact. Last year, 47,000 people died of drug overdoses in the United States. Because you're smart, you know these deaths are preventable. But here's something you may not know. Some kinds of prevention don't work. Just who taught you how to do this? It's time to stop the drugs. We've tried all these things, and still the number of people dying of overdoses continues to rise. But remember, you're smart. And because you're smart, you want to stop these preventable deaths. Do you know what is clinically proven to work? Harm reduction. You remember that, right? That's it. Harm reduction works for people who use drugs. It knows that people aren't perfect, but They deserve every opportunity to be as safe as possible. It encourages people to get educated and connected with healthcare. Harm reduction provides access to naloxone, the drug that reverses overdoses. It provides people with sterile supplies to prevent the spread of HIV and viral hepatitis. And when harm reduction is implemented in its most effective form, it gives people who use drugs access to supervised injection facilities in order to provide life-saving interventions in the event of an overdose. In 102 supervised injection facilities worldwide, there's yet to be a single fatal overdose. With more than 47,000 overdose deaths each year, what are you waiting for? Support safer, healthier communities by supporting supervised injection facilities in your city today. Learn more at www.harmreductionactioncenter.org.
All right, so when we think about harm reduction, one of the strongest things a harm reduction conveys is it really conveys compassion. And it conveys compassion because it's this piece, let me just go here for a moment, where it really shows you, I meet you where you're at. I think we all say we meet clients where they're at. But when we practice harm reduction, we truly do. Because you're getting the message from me, I accept you and I embrace you, even if you're still involved in the commercial sex industry. I see you and I embrace you, even if you're still using drugs, even if you're still running away, even if you're fill in the blank with whatever risky behavior youth or young adult is engaged in. Because many times our clients and simply humans get the message, I will embrace you when you stop doing. I will praise you and reinforce you when you stop doing all this bad stuff. And with harm reduction, again, it just conveys, I am here to support you wherever you are on your journey. Rather, whether you are somebody who is at a place and you're being honest and saying, I'm not ready to stop. And in that case, we want to teach the individual, how do you engage in the behavior in the safest way possible? And again, this doesn't guarantee safety, but if they are able to increase their safety just a little bit and increase it a little bit more and increase it a little bit more, there is such power in doing so. And one of the things I found from working with folks who've experienced so much trauma in their lifetime when it comes to really just safety is it's hard to sit with someone, a provider, and talk about things like safety planning, doing all these things that we do if that individual doesn't value their life. And so we have such a role that as I'm working with them, I'm conveying this piece of I see you and I embrace you where you are because you deserve safety. You deserve health and wellness. Now, harm reduction operates on this continuum. So again, we might have someone who's still actively involved in the problematic behaviors. And if that's the case, our goal is to help them increase their safety while they're engaged in it. And then we could also see this middle aspect of managed behaviors. So maybe we have somebody, for example, who is engaged in the commercial sex industry. And let's say, for example, maybe they were doing it every day of the week, and now maybe it's only on Friday and Saturdays. So we're starting to see kind of some decrease in the behavior. They're really kind of limiting it. And then we also see abstinence on here, where whatever the problematic behavior is, involvement in the commercial sex industry, drugs, running away, cutting, etc. Abstinence is here as well. And so sometimes there is this big, it feels like there's this big tension between abstinence and harm reduction. And that's where it's important for us to acknowledge abstinence is actually part of the continuum when we think about harm reduction. All right, so a few things harm reduction, our focus becomes. One is we aim to reduce the negative consequences of the behavior. And so, think about, for example, our folks who are engaged in the commercial sex industry, they're obviously engaged in sex acts. And so we want to think about how can we teach them and support them in being able to be as safe as possible. So, for example, they don't get diagnosed with an STI. They don't end up with HIV. They don't end up with an unplanned pregnancy, etc. We also are focused on addressing the conditions of the behavior as well as the behavior itself. And so, what this implies is we aren't just focused on what you do, so not just the what, but we're focused on the how. How are you engaging? So, for example, again, we know our kids involved in the commercial sex industry, that's not the only issue we need to address. We might have somebody who is also engaged in non-suicidal self-injury. They're cutting themselves. So I'm not just concerned about the fact that you're cutting. I'm concerned about how are you doing it? Because when I understand the how, that's where harm reduction comes in. I'm able to understand what are you currently doing and how might we be able to increase your safety around that specific behavior. We also are really anchored and centered on the agency, the dignity, and the well-being of the individual. And this is where it's tough because when we care about our clients, and especially when we work with young ones, we want them safe. We want them thriving in life. I can't want it more than they do. I can't make, and this is tough, I can't make somebody change. They have to want to change. And so this is really where I have to anchor myself in recognizing this might be me recognizing the fact that, you know what? They're alive right now in front of me. So they're doing something right. They're already practicing some harm reduction, might not be legal, might not be the healthiest, but they're doing something to keep themselves alive today. And I might have to start from that place and build off of that so that I really am seeing the fact that this is their life. They are capable of making these changes and that they are seeing the worth of their life. Now, as I've mentioned, there can be a lot of pushback when it comes to harm reduction, and perhaps maybe even some folks on are a little like, I don't know about harm reduction. And that is, we welcome you here if you are in that spot. And so I just want us to take a moment and think about, when we encourage somebody, when I'm not just telling somebody to stop, but I'm working with somebody on how can we increase your safety? Does that encourage them to continue in the risky behavior? Because again, that's a pushback many times. Is like if you're not telling, and I've heard this pushback from everyone, from folks of all professions. And this is what makes it hard to practice harm reduction because you got somebody telling you, why aren't you just trying to get them to stop? Well, we know telling people stop doesn't work. Telling people simply change doesn't mean they're changing. They have to want to do it. And so until they are willing to make those changes, again, we want to help them increase their safety. This going back to one of the things we touched on here with the fentanyl testing strips. There is some researchers, I believe they were out of Philly, and they were studying the effectiveness of fentanyl testing strips as a harm reduction strategy. And so they were working with folks who were already using drugs. And what was so fascinating was that over time, these folks who were using the drugs developed a relationship with the researchers because they started to reach out and say, hey, my strip says X, Y, and Z, and what the researchers concluded, well, let me back up. So what they found is over time, these folks who were being taught how to use the fentanyl testing strips, the majority of them ended up decreasing their drug use. And what they concluded as to why was how powerful it is when you know you have somebody you could go to and talk to who's not judging you for using. And again, how many times do our clients experience that? and sometimes aren't as honest with us about the actual behaviors they're engaged in or the extent that they're engaged in it because they worry about that judgment. And so if you are here in a little, I don't know about harm reduction, I hope as we talk, you get a little bit more comfortable with it. And also for folks who maybe are a little worried about like the regulatory piece, I might have, kind of social worker pushing back or, fill in the profession, of somebody kind of pushing back and saying, why are you practicing harm reduction? Why is there a goal here, on client's treatment plan related to harm reduction? Know that the California Department of Social Services, oh gosh, I believe about 2019-ish, actually put out papers saying we support providers using harm reduction strategies because there is that much like, I don't know if it's okay to do. We have the green light, from our state agency saying, yes, when it comes to working with kids who've been trafficked, we should be practicing harm reduction with them. And I recognize we are forgetting an M right there. All right. And so we're going to think about some principles here. So we're going to think about some harm reduction principles and apply them to folks who have been exploited and or are in the commercial sex industry. And then we're going to get into some specific ways we could teach clients how to practice harm reduction who are in the commercial sex industry. So one is we have to accept that the commercial sex industry is part of our world and we work to minimize the harm rather than ignore it, condone it, or kind of even magnify it. And so whether we like it or not, the commercial sex industry exists. Unfortunately, it is a thriving market. And given that, again, our work becomes how do we help those folks who are engaged in it be as safe as possible? We also understand that commercial sexual exploitation is a complex issue. And we acknowledge some behaviors are safer than others. And so when we think about just how complex it is, as we think about the early childhood trauma so many of our youth experience prior to entry into the commercial sex industry, let alone just the ongoing amount of trauma one experiences while they're being exploited. Even working with folks and talking to folks who had that lived experience of being involved in the commercial sex industry. So many continue to experience trauma afterwards. For example, many folks who've been exploited in the commercial sex industry many times find themselves in domestic violence relationships afterwards. So again, we just acknowledge this is a very complex issue, even as we think about who the folks are who are exploited in the commercial sex industry. And we think about a disproportionate number of Black and brown bodies. And why is that? And again, there's just so much when we really start to understand the issue, we start to understand there's so many issues tied to it. We also acknowledge some behaviors are safer than others. So, for example, somebody engaging in anal sex versus oral sex. Somebody engaging in the commercial sex industry all by themselves and going to some abandoned parking lot versus somebody who is out there on the streets and working with peers versus somebody who maybe is in pornography. So again, there are certain behaviors that can carry more harm. We also work to establish quality of individual and community life and well-being, not necessarily abstinence as the criteria for successful interventions and policies. So one of those questions I want us to think about here for a moment. How do I define success? Because if how I define success and if how my treatment plan says success is abstinence, what happens if that's not where clients at? I'm kind of setting us both up here. And so I really want to think about what is client's goal that they're wanting to work on. And it might not be anything related to the commercial sex industry. I remember years ago, when I was starting to do work around trafficking. And we would hear from so many of our kids in care. One of their biggest complaints was the only thing people want to talk to me about is the commercial sex industry. Providers don't want to talk to me about anything else. And that's not the thing I want to talk about right now. That's not what I want to help and support on right now. But that's the only thing providers are wanting to work on. The other piece here, and this is where we see that, and we're reminded that we operate and we live in community. And so if my client, let's say I have my client and I'm teaching my client harm reduction strategies, because again, we operate in community, we see this client being able to share these strategies with others. In talking to folks who've been involved in the commercial sex industry before, would hear this oftentimes. They would teach each other different ways to stay safe. Or if there was a bad customer, they wouldn't just keep that to themselves and let other people go through all that. They'd spread the word. So people knew to stay away from so and so. Again, this is that it enhances that community life. We also provide non-judgmental, non-coercive services and resources to folks who are commercially sexually exploited to help them reduce the harm. And so again, sometimes our clients get the message from us. We want them out of the commercial sex industry. We want them thriving in all these wonderful ways, which of course we do. But in wanting that for my client, does it hinder their ability to tell me what's really going on in life? Does it hinder their ability to tell me exactly all that's going on? Because if client worries, you're not going to get it. Or maybe it's not so much judgment, maybe it's disappointment. They might not open up to me and tell me the extent of what they're doing. And if I don't know the extent, how am I supposed to support them? We also ensure folks who have a history of commercial sexual exploitation routinely have a real voice in the creation of programs and policies. And this just makes sense with any population we're aiming to serve. We want to make sure that folks who have that lived experience are speaking into the services, that we are getting feedback, we're doing focus groups, all of that stuff to include their voice. We also want to respect individual differences, including culture and traditions. And so a moment ago, I mentioned that, when we think about who is exploited, we start to see a disproportionate number of Black and brown bodies. And so what does that look like for us to make sure we're providing culturally informed services? What does that look like when we think about even just our mental health system, our social services system, which are really built upon white middle class values? What happens if that's not my client or my client's family? How am I making sure I'm understanding trauma through their cultural lens? I'm understanding health and wellness through their cultural lens. I'm understanding how does one obtain that health and wellness through their cultural lens. And I'm not just seeing them through my experience and my cultural lens, or I'm not just putting on Western society's ideals and values onto them. We also recognize that our youth and young adults who are commercially sexually exploited are the primary agents of reducing the harms of their circumstances. And we seek to empower them to share information and support each other in ways that meet their actual circumstances. So again, our youth and young adults, they're going to be the change makers, which means I have to really check how I view them. Am I seeing the strength and resiliency that's there? Or am I only seeing all the trauma and drama? Do I see this young person as being capable? Because for some of our youth and young adults, and given all the trauma they've experienced, it takes a toll on your self-worth. It takes a toll on your self-esteem, and I know you all are aware of that. And this is where it makes a world of difference if you're working with somebody and they see you as being capable. You got this. That provider never has to actually say those words, but you get the sense when you're around this person, they believe in me. And you get the sense when you're working with somebody who doesn't. We also acknowledge the real and tragic harm and danger associated with the commercial sex industry, rather than kind of minimize it. And so as we think about, again, just so much of the trauma that our young ones go through, this is why we started off here. And this is why that self-care becomes so important. If I am not intentionally and regularly taking care of myself, how am I holding hope for my client? How am I showing them more is possible? You deserve better. Because if I'm not taking care of myself, and again, I'm exposed to so much, that vicarious trauma in me just grows and grows and grows. And this is where we recognize it's hard work. Imagine, I'm not sure if anyone on has had really horrible stuff happen to a client. Or maybe a client has died while they've been involved in the commercial sex industry. That takes a huge, huge toll on you. But if I'm not taking care of myself, how might I carry all of that onto the next person that I see and the next person that I see? And so there again is where it's so important that we are doing what we need to protect our hearts and our minds so that I don't minimize, I don't just get overwhelmed by the harm and danger that's there. We also focus on their capabilities, build off their strengths. Now, this can be hard because if I'm working with somebody who's actively involved in the commercial sex industry who tells me, I'm not going anywhere. This might be the person we have in placement and they're running away to go back to it. We're seeing all of these behavioral issues. For folks who are familiar with the stages of change model, these are our folks in the pre-contemplation stage. It's hard sometimes to see their strengths because all we're seeing is the negative. We're getting the phone call after phone call about so-and-so's doing this, X, Y, and Z is wrong, etc. But again, we want to focus on the fact that that strength might not be present or seen 100% of the time. And mind you, none of us have strengths that are present 100% of the time. We might see that strength only a small percentage of time, but guess what? When we see it that small percentage of time, we got a starting place, and we could grow it. And when we grow it, we could grow it a little bit more. And when we grow it, we could grow it a little bit more. And this becomes big, especially I've seen this be a huge challenge, especially for our young adults involved in the commercial sex industry. What's this like when you get out and you're in your 20s or 30s? You have no resume. And this is where, so many folks doing work with that population talk to them about transferable skills. What are some things you're good at that you could still include on your resume? Because again, when you are trying to start new and you're starting from a place of nothing, or you're starting from a place of deficit, that's just depressing. When I recognize I got something to start with, that gives me a little like, I got this. So we also become aware of so many of the intersecting issues. Again, when we think about going back to earlier, we talked about how commercial sexual exploitation, it's a complex issue. And this is why. To understand why the commercial sex industry continues to thrive, why we have kids who continue to be exploited in the commercial sex industry, is we got to address these things. And we haven't done so well at addressing these as a nation. Because poverty, classism, racism all play into why folks end up exploited in the commercial sex industry. Also, when we think about things such as social isolation, previous histories of trauma, sex-based discrimination, and other social inequalities, they affect folks' vulnerability to and capacity for effectively reducing harm related to the commercial sex industry. And this is where we recognize that our youth and young adults have very different experiences in the commercial sex industry based off who they are. Just as racism exists in everyday society, it also exists in the commercial sex industry. So a Black woman being exploited in the commercial sex industry is going to have a very different experience than a white woman being exploited in the commercial sex industry. You will also, I just want to acknowledge, you will hear me reference women oftentimes because that has been 95% of who I've worked with. And in doing work with folks who have lived experience in the commercial sex industry, the large majority have been women that I've spoken to. And I just want to acknowledge that, and also acknowledging it is not just women and girls who are exploited in the commercial sex industry. Also acknowledge their involvement in risky behaviors can be an attempt at exerting control and power in which maybe they feel like they don't have very little. And that really takes us applying that trauma-informed approach and us trying to understand, why does this person continue to stay involved in this really dangerous situation? There's a reason why. Needs are getting met. But if all I see is the behavior of you're engaged in the commercial sex industry and I'm not trying to understand the why, it makes it hard. It reminds me of some years ago, I would hear from providers of all disciplines. And one of the big questions was like, how do we address this with clients? Was folks would get really stuck when their clients started talking about kind of the glitz and the glam, all the money that could be made. And then folks would be like, I don't kind of like, I hear the amount of money and it sounds pretty good. Like, I don't know what to kind of like, I don't know how to respond to it. And that's that example there of getting lost in simply the behavior. Because when I understand and really listen for, what does that money represent? Why is that important? Especially as I know that kid isn't keeping, they don't have a dollar on them, despite the fact that they're talking about all this money that can be made. So I have to understand again, what does that money represent? Why is it so important? We also acknowledge unhealthy coping can be used to minimize harm while one is being commercially exploited, commercially sexually exploited. We don't want anyone to be unhealthy. I think we could agree to that. We want everyone to thrive in health and wellness. But we also have to recognize some folks might use not the greatest of coping skills, but guess what? It's what they have. And two things. One, I have to remind myself everyone is doing the best they can with the resources they have. If my client could do better consistently, they probably would. If I could do better consistently, I probably would. So let's say, for example, my client might be smoking weed to cope with all the stress. I don't want them smoking weed, but that's how they're managing, coping with all the trauma they're exposed to. And if client gets a message from me, I'm kind of judging them a little bit for smoking weed, they're probably going to stop talking to me about it. Just to share one example, it came to mind as I was mentioning that. One young woman who was in our foster care system, as well as who was trafficked for many years. She now is an adult, and shared this story where, as some of our clients do, especially when we first start working with them, if there's a little angst in them, they might try and test us or kind of see if they say something, will we kind of be off put by it. So she was kind of in that space. And she was talking to, I believe it was a social worker she was working with. And social worker, is like, just trying to build rapport. And social worker asked, just what do you like? Tell me about you. And she's like, I like to smoke weed. Now, a social worker kind of knew what she was doing, and so wasn't responding as previous ones had of kind of like, or like, well, what else do you like? Responses like that. The social worker's response was, oh, I didn't know that you like to garden. And for this teenager at the time, she was like, her response threw me off. I was like, gardening? Like, who gardens? Like, what is that? And she reflected on this interaction as when she was a teenager and being trafficked with the social worker, because now as an adult, she loves to garden. And it's this piece of, I didn't even think, like, I didn't even know what gardening was. And social worker kind of said that when I was talking about how I love to smoke weed. And it kind of got me just thinking about, like, what is gardening? How does gardening relate to weed? And the more she started to think about it, now, she's a young woman who has a beautiful garden in her backyard and loves to get out there and get her hands in it. All right, see the beliefs and behaviors as developmentally and practically necessary for young people who have not been able to otherwise get their needs met. Now, this is where sometimes as providers we experience tension because I could be over here like, hi, we have services at my organization. There's services you could go to here, 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 here. And so it feels like you have options, you're just not choosing them. And what I want us to see here is just because I see their options doesn't mean client does. For some of our clients, they have been shamed and blamed by service providers. And that's just been off-putting to service provision as a whole. For some of our clients, they have been abused and exploited by people who are in our professions. I wanted to share two examples of that. Earlier, when I was doing work around trafficking, myself and a colleague who has lived experience of being trafficked, and when we were training on just kind of more of a basic, what is trafficking? She would do this exercise, and we were training on it maybe twice a month for over a year. And she did this exercise every time we trained, and every time it turned out the same way. She would ask folks to raise their hand and ask for a few folks to share what profession they were. So you would get your range of folks associated with our kids. I'm a social worker, I'm a group home staff, I'm an educator, etc. Every time somebody would raise their hand and say, I'm a psychologist, her response was, somebody who had your title purchased me for sex when I was a minor. And there'd always be gasps of like, because you wouldn't think somebody who was a social worker, somebody who was a psychologist, somebody who was a group home staff, etc., would do that. But again, people do. Prior to leaving residential care, we had one kiddo who had been trafficked. And long story short, she ended up running away. And sometime later, this was probably about 6 months, 6 to 9 months later, after I'd left residential care, she had run away kind of right at the tail end of my stint there in residential care. About 6 to 9 months later, when I was doing some focus groups in juvenile hall, she was there. And I was so relieved just to know she was alive. And it turned out just to be a great conversation. She was kind of taken aback and couldn't believe how much we worried about her and we're trying to find her and all this stuff. But out of that conversation, she had made a comment and it stuck with me. And she goes, how am I supposed to trust people like you when I see staff out there on the street too? And she left the comment at that. She wouldn't clarify if she meant like buying sex or selling sex or what. But it was that piece. When I see people who have titles of a helping profession out there, it kind of destroys my trust in the helping profession as a whole. So again, just because I know I'm not going to buy sex from a minor, that doesn't mean client's going to trust me. Because when I strip away my title as a psychologist, I'm simply a human being. And our clients have been so hurt and betrayed by humans, which, as a side note, that is where when we think about how do we support these folks, it is through relational work that we support them. And I also want to understand again what needs are getting met, what needs led to their involvement in the commercial sex industry. And many times our focus becomes on the tangible needs. And what we oftentimes overlook are what were some of the emotional needs that led to that involvement in the commercial sex industry. And what were the tangible as well as emotional needs that continue to be met in the commercial sex industry. Last thing I'll say here about this point for us as providers, we get impatient. And we get impatient sometimes because we have pressure on our shoulders where our services are getting shorter and shorter in terms of length of services. So I got that pressure to kind of fix this kid in 3 months, in 6 months, etc. And one, that healing journey is much longer than that. But also, when we think about, again, what our clients are experiencing, what they've gone through, I could tell them your needs could get met in a healthier way when you leave the industry. But for many folks, you have to see it and you have to experience it to really believe it. So it can't just be telling, it has to be showing. We also focus on their most pressing need, which may or may not be the need I think we need to focus on. So, for example, I could be working with this kid and think, well, obviously, we need to focus on getting you out of the commercial sex industry because you're involved in it. That might not be where they want to start. And as we know, if I start to impose my agenda, I'm going to get nowhere. So I have to make sure I'm starting where they want to start. We also focus on incremental gains that can be built over time. So again, I want to be setting clients up for success. As we increase safety, we want to increase it a little bit more. And when we increase their safety, we want to work with them on increasing it a little bit more. So again, it's kind of these little baby steps. And we're taking some more baby steps. And when we take those baby steps again, we're taking more. So when we focus here on harm reduction, 3 aspects we could focus on. One is we want to think about risk factors. So we could, focus on risk factors because we know there's lots of them. Poverty, our youth who identify as LGBTQ+, our youth who are growing up in the foster care system and the juvenile justice system, folks who have histories of past sexual trauma, folks who are growing up in group homes, and the list could go on and on and on. So we know, and research has shown us, and for some of us just simply practice and doing work in this field has shown us, there are identifiable risk factors. So one way we could think about harm reduction is from a preventative standpoint. How can we help prevent these youth who've experienced lots of trauma experience more trauma by getting involved in the commercial sex industry? And so a harm reduction through that lens might be we do a preventative curriculum with them. One big one that we are using in California, one of the ones I got to help work on is word on the street. And that's a great, I say that a little biased, but a great curriculum that we've been using in counties throughout California for a number of years. Also, a second focus, address harms introduced in the commercial sex industry. So, for example, let's say we have a young person, no history of drug use. They get involved in the commercial sex industry, and now by the time they come see me, this young person is addicted to X, Y, and Z. Now, that drug use could be one of 2 reasons. One, maybe they were forced to use drugs and develop that addiction that way. Maybe this person chose to use drugs as a way to cope with all the trauma, regardless, now we're not only addressing all the trauma from involvement in the commercial sex industry, now we also have addiction that we're trying to navigate. We also want to address the third thing we want to focus on here is we want to focus on addressing mutually reinforcing factors when folks are commercially sexually exploited. So when we think about mutually reinforcing factors, another way of thinking about that is thinking about why are they staying in? Why does this, or especially our young ones who run away from what seems to be a great living environment, and you run away from that to go back, and you continue to do that? There's a reason they're running back. So what is it? For example, maybe we have a young person who in the commercial sex industry, it feels like I am put up on a pedestal. I'm praised, I'm adored. I get all this positive feedback. Outside of the commercial sex industry, I'm constantly being nagged by providers, being told, you aren't doing this, you should be doing this, all the shoulda, woulda, couldas. I don't get any positive feedback. So that tells me we need to kind of shift how we're viewing this person and how we're doing it. So another example, say, for example, we have a young person who, for them, the community around them in the commercial sex industry it feels loving. Now, mind you, this young person can have such a skewed view of love, not only from their involvement in the commercial sex industry, but again, we want to keep in mind for so many of these young people, that abuse started so early on in life and it's continued. All right, we're going to hear Hillary share a little bit of her story. And as she does, we're going to be able to touch on aspects of all three of those. We're going to hear some of the risk factors. We're going to hear her share some of the things that were the harms as she was in the industry. And then thinking too about, well, when the first bad thing happens to you, why don't you get out?
Hi, my name is Harmony Dust Grillo, and I used to be a stripper. So I was raised in a very violent neighborhood in a chaotic home. Just as an example, Domino's Pizza would not deliver to us after dark, and even the police wouldn't come to our neighborhood after dark. I remember being 8 years old and someone coming into our home and beating my mother nearly to death with brass knuckles. And it wasn't until 3 days later that the police finally came. She called them, but they didn't show up. And she actually, before she lost consciousness, called a friend who ended up taking her to the hospital and saving her life. And I can still remember sitting in the living room when the police finally showed up and knocked on the door and said that they got a call, that there was a disturbance. So that's kind of the context that I grew up in. My household was really chaotic because my mother struggled with drug addiction, and that meant that I was exposed to a lot, including sexual abuse from a very early age, starting at the age of 5. And then I was raped as a teen. One of my abusers was my mother's boyfriend. At that point, I was 13, and I finally started standing up for myself. And I ran away from home. And my mom realized that I was serious and that I wasn't coming back until he was gone. So she finally kicked him out. I came home, only she left with him. She ended up leaving with him. And so she left me at 13 with my 8-year-old brother for 3 months with $20 and a book of food stamps. And obviously $20 didn't last very long. The food stamps didn't last very long. So I started stealing from the liquor store to feed my brother and I. And it was that summer that I became involved with an older boy in my neighborhood. Because the situation I was in, I just saw knight in shining armor. When he was around, I didn't have to steal because he would buy my brother and I food. And when he was around, I felt protected in that neighborhood that I lived in because he would always tell me, I got your back, I'll take care of you. And so I became really, really attached to him. I ended up in a 7-year long relationship with him that ultimately became physically and emotionally abusive and led me to working in the sex industry as a stripper. And my boyfriend became my pimp. So every night I came home and gave him all of my money, and he completely controlled my entire life. And I was so broken just from years of abuse and low self-esteem that I let him control my life. Afraid to leave him, didn't see a way out, felt completely trapped in that situation. The thing about the sex industry is that those of us that are in it, most of us, we end up using a stage name. And with that, also creating an entire alter identity that we hide behind. And so I remember the first night I showed up for my very first shift, and the DJ said, what do you want to go by? What's your name? And I hadn't really thought of it. So I said, Harmony, that's my name. And I remember watching him write Harmony in black dry erase on the whiteboard. And it was too much. And so I said, no, take it down. I'll be Monique. And really from that night forward, for the next few years, I became Monique. And Monique was a compilation of other people's fantasies. Monique wasn't a real person. She was someone that I could hide behind while I was working in the sex industry. And not only was my name fake, but everything I told the customers was fake. Everything about the life that I created for Monique was a complete lie. It made me feel safe. And it was the only way for me that I could work as a stripper. But at the same time, eventually I began to lose sight of who Harmony was. And, the only people I had contact with were my abusive exploiter and other women in the club and the customers. And no one really knew who I really was. And honestly, I didn't know who I really was. A lot of people think, the sex industry is so glamorous and so empowering, but it's hard. And I don't think a lot of people see the reality of what women working in the sex industry have to deal with on a day-to-day basis. There's a lot of talk nowadays about sex trafficking. And, we're hearing, all these stories about sex trafficking and that it's happening here in the United States. But what I don't think everyone realizes is that 70% of female trafficking victims are trafficked into the commercial sex industry. That means they're working in strip clubs. They're working on porn sets. They're working for escort agencies. They're working in every single area of the commercial sex industry. That's where they're working. We can't turn a blind eye to that. And I think that's super important for people to know. We get called names and touched when we don't want to be touched. And, I remember there were several occasions where, a customer would violate me and sexually assault me. And, I was so angry. I would just take off my stiletto and I would literally beat them in the head with it. And I felt so powerless. From my perspective, it was self-defense. But they would look at me and see a woman working in a strip club that's half naked and think basically that I was asking for it. And so working there was really hard. Ultimately, what got me out of that, it began with a friendship and just a person who loved me unconditionally and didn't judge me for the crazy life that I was living, just loved me. And it was through that friendship that I saw an example of a woman who had boundaries. She really inspired me. So eventually I started going to church and I started just pursuing a relationship with God, and my heart started changing. My mind started changing. And I started to believe that, that I'm lovable and that I have value, and that maybe I was even put on this earth for a purpose that was beyond working in the sex industry as a stripper and being stuck in an abusive relationship. I finally got the courage to leave the ex-boyfriend slash pimp and leave the sex industry and start on this recovery journey, this healing journey that completely changed my life. I remember a few years after that, I found myself sitting across the street from the strip club where I used to work. And I felt like I was sitting outside of a prison that had once held me captive. And I knew that there were other women who worked there who maybe still felt as trapped as I once did. And I wanted to do something to support them. And so I didn't know what to do. And I just started writing handwritten notes on postcards and put them on their cars and just let them know, like, hey, I've been through maybe something similar to what you've been through, and I'm here for you. And it was from that moment that the vision of Treasures was birthed. And I ended up starting a nonprofit organization called Treasures, and we are an outreach and support group for women in the commercial sex industry and victims of sexual exploitation and trafficking. We reach women with a simple message that changed my life, and that message is that they are loved and valued and purposed, and that support is available for them if and when they want it, if and when they're ready, and that we're willing to just show up and love them unconditionally and walk with them through their process and their journey. Stripping changed my life. I was already a super broken girl going into it, and whatever sense of identity that I had left, I felt like stripping stripped away from me. I didn't think I would live to see 21. I thought if someone else didn't take me out, I was going to take my own life because I was that hopeless. And at the same time, you know, now I wouldn't be doing what I'm doing if it weren't for stripping and if it weren't for everything that I went through. What I really hope in sharing my story and sharing everything that I've shared today is that people will see the humanity in the woman on the other end of the dollar, and that, you know, behind every image that you see of a woman in a strip club, in porn, is a real person with a real story.
All right. So I want us just to reflect for a moment and think about, what is it? And this is what makes harm reduction hard to practice. How is it knowing this youth, this young adult, they might leave my office and they're going to engage in some unsafe behaviors? When I think about letting them leave my office, it almost feels wrong to not throw myself in front of the door and be like, you're staying here because if you're here, you're safe. And it's hard to know you are going to leave here. You might be assaulted tonight. It's hard to let you leave here knowing you might go cut. You might go do drugs. You might run away. You might do fill in the blank. And again, that's what makes it hard doing this work. And just going back to here, this is where us taking care of ourselves becomes so crucial, because it's hard when we care for someone and they continue to engage in risky behaviors. That becomes so huge. In the chat, we have the hardest lesson we have to learn as providers, often over and over again, is that we have to allow clients the autonomy to make what we perceive to be the bad choices. Absolutely. Because again, it's hard. It's hard when especially if we've worked with clients and bad stuff has happened to them before. It's hard not to assume this is going to happen to this client. And this is where we have to take care of ourselves. I have to make sure I'm getting the support at work and outside of work so I could do this work in a healthy way. So that as I'm doing this work, and this is where harm reduction comes in. Because if I know this kid's still engaged in these risky behaviors, or this young adult is still engaged in these risky behaviors, again, me telling them to stop isn't going to do anything. But me teaching them strategies to increase their safety and increase their safety and increase their safety, that's powerful. And there's hope in that. Also want us to think for a moment as to whether or not we feel the need to rescue. And mind you, especially when it comes to folks who've been exploited in the commercial sex industry, over the years, we've heard a lot of rescue. We've seen on websites for organizations, we've heard from providers, talk about they've rescued X number of youth who were engaged in the commercial sex industry. So it's hard not to get that idea in our heads that we should be rescuing people. And if we do think, I do kind of feel like I have to rescue people. Again, it just becomes a moment and an invitation for you to do some self-reflection. Where does that kind of desire or need come from? And how does it impact my work when I feel the need to rescue? Because many times, as providers, if I put it on my shoulders that I should be rescuing people, I should be fixing people, I put on way too much. I don't see my client as being capable. I see me as kind of the difference maker, not my client. And so, rescuing victims of domestic violence or domestic abuse from their abusive relationships as a strategy is now recognized as being unlikely to end the relationship, nor is it likely to encourage help seeking and recovery behaviors. We would do well to understand that commercial sexual exploitation is not a simple case of rescue, abstinence, or victim blaming when a young person doesn't willingly leave an exploitive relationship. In addition to that, many times in talking to folks who've had lived experience of being trafficked, when they start to hear, organizations or providers talk about, we've rescued, you know, many times the response is something along the lines of, no one rescued me. I rescued myself. I had people who walked alongside me along the way and helped me. They didn't do the work. I did the work. And again, when we start to see ourselves as the savior, see ourselves as the rescuer, I'm kind of the one puffing up my chest, kind of taking onus of things. And I minimize the hard work that individual has to do to leave and to stay out. All right, so a few things we want to consider. And this goes back to earlier how I touched on the fact that not everyone's experience in the commercial sex industry is the same. Some folks may experience higher risk of violence than others. Some folks may have very different experiences or treatment in the commercial sex industry based off who they are. So the greatest concentration of harms are concentrated with those of lower status, those who are soliciting on the streets and in open sex markets. So when we think about this, say for example, we have a Black transgender female. That is somebody who in the commercial sex industry who lacks status. You know, she is going to be at higher rates of experiencing violence. And not to say that other people don't experience violence or things don't happen to them, but at heightened rates because of who she is. Also, the youngest, most serious assaults and greatest number of murders were concentrated in sex markets where folks worked alone and where they lack status. So again, not to say like we're saying go recruit your friends, because we're not talking about go recruit more people. So you're not by yourself, so you're safer. We know there's lots of folks already involved in the commercial sex industry, and it's safer to do so in community. Because again, if something horrible happens, word gets around. If people know you're getting in the car, but they know what time to expect you back, and you're not back, they're out looking for you. It makes a world of difference if the person's car you're getting into thinks somebody is expecting you back, and you just shouted out their license plate number. So people know kind of who to go after if you aren't back. So again, some folks, just given who they are, um, can carry more harm. Also, where are they soliciting? Are they on the streets versus they're dancing in a strip club versus they're in a pornography video? All carry harm, but different degrees of harm. Also, looking at specifically women who've been involved in the commercial sex industry. Violence against women in the commercial sex industry is often with those who solicit on the street and provide sex in isolated and abandoned areas. Kind of makes sense. If you're getting in the car and somebody's taking you to this deserted area, as opposed to a hotel where people are in and out, there's, kind of constant traffic, those two scenarios are vastly different. All right, now we're going to get into the practical piece here. And we're going to think about what does this look like for us to apply harm reduction. So first thing we're going to think about is something that we already are doing with clients is safety planning. And so we're going to think about how do we create a safety plan through this harm reduction lens. So first, we want to see safety planning as an intentional engagement opportunity. And we build a relationship of trust. Because again, we want to remind ourselves, so many of our youth and young adults, given all the trauma that they've experienced, they don't think too highly of themselves. And if I don't think too highly of myself, do I really care what's going to happen to my life? Do I really think I deserve better? Do I really think I deserve a future? So that intentional engagement opportunity is me starting to convey this message. You might not see a future for you yet, but I do. We're talking about safety because you are a worthy human being. And you deserve it just as much as I do. We also then want to determine what do they want to work on. And this is where it's tough because I'm hearing them and it feels like we're out in left field because I think there are more pressing issues. But as we know, we are going to go further and do better, meeting them where they're at than where I think we need to start. And if I need to, make some documentation as to why we're starting here and not there, I could do that on kind of the administrative side. But I'm going to do better working from a standpoint of where they want to start. And then again, we operate from a strength-based perspective. So we want to identify what are their current strategies for keeping themselves safe. Now, mind you, they might not think I'm doing X, Y, and Z to keep myself safe. But we want to remind ourselves they are alive. So they're doing something. What are they doing to stay alive? How are they getting through every night? How are they navigating X, Y, and Z? Again, they're doing something. And this is where we show compassion and we show some grace. They might not be the strategies we think are the healthiest. Might not even be legal. But guess what? They are doing things to keep themselves safe. And once we identify what they're doing, again, it conveys like you got something, you're doing something. We could build off of those. And maybe it's something that isn't the healthiest, but I understand what they're trying to do. I could teach them other strategies in. We also want to conduct a risk assessment. And so as we do a risk assessment, and we're just going to touch on a couple things here on the next two slides to consider when it comes to a risk assessment. But then we're able to figure out, okay, what areas do we need to incorporate into the safety plan? And we work with them on figuring out the safety strategies that are specific to them, that aren't things I'm just saying, okay, we're going to work on X, Y, and Z, and here's how you're going to do it. Here's your safety plan. I'm coaching them, I'm guiding them to creating their own safety plan because, again, it's their life. They have to be the ones owning it and owning the safety plan. And if they aren't owning it, they're not going to do it. And so we work over time on building more adaptive coping. And this is where we remind ourselves. For so many clients, while they're working on building these adaptive coping skills over here, guess what? They're still using all these unhealthy ones until they see these ones actually work. Too often, the expectation from providers is, well, I taught you these healthy ones, so stop using these. That's not life. They have to see that these things actually work. So while they're seeing and kind of testing the waters with these healthy ones over here, they're more than likely using these. And I have to, again, approach them through a place of compassion, approach them through a place of not judging them for doing so. All right, so some things we want to consider in a risk assessment. I'm not going to go through these. You'll have these just as reference when you get the slides. But in a sense, we want to figure out what are some of the harms that have happened to them, whether it be physical, whether it be sexual, whether it be drugs, etc. So that as we better understand the harms and the potential harms that you are encountering, it's going to help us really tailor that safety plan to your specific needs. And the more specific we tailor that safety plan to these are the needs that you have, these are the areas of concern that you have, it helps us then think through that harm reduction lens. How can we figure out what you're already doing for safety, and how do we build off that, build off that, build off that? All right, so we're going to look at some harm reduction strategies. Again, as we think about harm reduction, we take this jump from focusing on safest to safer. Safest is don't do all the bad stuff. Don't do all the unhealthy stuff. Don't do the risky stuff. We're talking about how can we help you be safer when you are engaging in those. So some general things. Identify escape strategies in hotel rooms, cars, houses. And again, some of these things clients might already be doing, and we want to help them see, hey, this is a strength. So for example, how do I walk in this room and without making it super obvious, I'm kind of scanning the room? How can, when I walk in a room, how can I kind of scan it to see where are my exits? And not just the obvious ones like the door. How else could I get out of this room if someone was blocking the door? For me, in the room I'm at, I got a door, I got a window. Door's obviously going to be the easier one. Window, not ideal. Is there anything in the way of getting to either of those? So again, if I needed to get out and get out immediately, where are those escape rooms? If I'm in a hotel, think about, for example, when you go to a hotel, when you get off the elevator, you usually see kind of like a map of the floor, of teaching folks to kind of scan that to know where are the exits. So I know if I run out of my hotel room, I know which way to turn to hit the stairs to exit. Because if I go and hit, the elevator, I'm going to wait, and that's going to give the person time to catch me. So I know if I have to run out, again, I know how to get out as fast as possible. Also, either having key documents on hand or keeping them with someone. And so, this could be a provider, this could be maybe a family member, etc. Also, and this is an important one for us even, memorizing contact info. Too often we rely on our cell phones, but what happens if it's not charged? I left it, I lost it, so and so broke it. How am I supposed to call, whether it's you or someone else, when I don't know your number? So encouraging folks to memorize contact info for about 3 key folks. And I always like to add 3 key folks who you know are going to answer your phone. I know my husband's phone number. He's horrible at answering his phone. If I were in a situation, I don't know if I would call him because I know he'd probably be unlikely to answer his phone because that's just how he is. So who are some folks you can reach out to if you needed help immediately, and they're going to likely answer their phone. Also, developing a code word. So trusted people know you're in danger and need help. So for example, maybe I do have my phone, I have access to it, and I could hop on a call here. But I can't, really say, hey, I'm in danger, please come help me. But I know, person I'm talking to knows I said, are we having pizza for dinner, for example? And they know that phrase means come get me because we already have that understanding. Also sharing your GPS. and this might not only be with a provider, but also each other. When we think about folks who operate in community in the commercial sex industry. So when folks have their peers, being able to share that GPS location, so folks know where you're at. Some other general safety tips for folks who are not animal people, you will not understand this first one, but making arrangements for pets. We live in a day and age where many of us love our fur babies like they are real babies. And there have been times where folks who've been involved in the commercial sex industry haven't left the commercial sex industry because they didn't trust so and so with their dog. And so, making sure that those fur babies, if they have them, plans are in place. Also, just some general safety things, taking alternative routes. So let's say, for example, one of those things on the risk assessments was, I'm kind of concerned somebody's following me or someone's spying on me. Now, mind you, that might be realistic. That might also be person exploiting me has had it ingrained in my head. I know where you are 24/7, whether or not they actually do, but it feels like they know where I'm at 24/7. So we might talk to them about, instead of, let's use walking to school, for example. Instead of walking the same route to school every day, mix it up. Take a different route. Leave a couple minutes earlier, leave a couple minutes later. So it make it really hard for somebody to anticipate where you're going to be because you're taking alternative routes. Reaching out to your support system. And not just of providers, our goal is to build a natural support system who is going to be there well beyond us. And I did identify different strategies for personal versus life-threatening crises. So sometimes our clients, and I've seen this happen mostly with advocates, where clients build great relationships with their advocates, but sometimes are reaching out all hours, day of night. And it's not necessarily, this life-threatening crisis like my life is in danger. It's more of a personal crisis. I've seen everything from, I don't like what the group home's having for dinner. I need you to pick me at McDonald's. And they're making it sound like it's life or death. Now, we don't want to minimize how stressful that situation is, but we want to teach them the difference between a personal crisis versus a life-threatening crisis and know who we could reach out to in each. We also want to identify things that are supportive. And so I want to know, and we want to have dialogue. In the past, many of our youth have been through services in the past. What's been helpful? What hasn't been helpful? If you were struggling, what would be helpful for me to do? Too often we make the assumptions. We just assume we're helpful. So me just being me is going to be great. And that may or may not be what client needs. So I want them to tell me. I want them to guide me. What do you need from me? As a side note, when we think about the stages of change and somebody having a relapse, and we see that process of recycling. And if this sounds foreign to you, I encourage you to do some training on the stages of change model. But when that happens, too often we point the finger at the youth. And we point the finger at the youth and kind of like, well, what did you learn? And what can you do differently next time? And what we don't do is point the finger at us as a team. And we want to have it's this collective we. What can we learn and what can we do differently? Because if we truly are supporting you, we want to know what worked and what didn't work in terms of how we supported you. So again, we could adjust that plan going forward. Some other kind of general ones. Identifying red flags in a situation and what to do. Now, this is tough because when we think about trauma can really make you feel foreign to yourself. And when somebody feels foreign to themselves, it makes it hard to do things like listen to your intuition. Where a client might find themselves in a really risky situation, for example, I've seen one of the ones I've seen so often, client gets into a car. Horrible things happen to client. And everyone's like, what are you thinking was going to happen when you got into the car? Well, that's easy for me to say because I'm seeing red flag after red flag after red flag go off. But for client, if they are so disconnected from themselves that they aren't recognizing that intuition and those red flags going off, they're not seeing all that. All they're experiencing is the shame afterwards of like, I should have. We also want to encourage practicing asking for help. And so practicing reaching out and being able to say, hey, what I need, what do you need? And one thing we want to make sure we're doing here as providers is I've seen this happen countless times, is when client does start to stabilize, clients starting to do what they're supposed to do, they're starting to engage in healthier and healthier behaviors, and they're getting all of this praise, like, good job, we're so proud of you, etc., which we are. But what can happen is it makes it really hard for client to reach out. And I've heard them say this, I didn't want to disappoint you and let you know I was struggling. So we want to make sure we send the message. We are here to support you, whether it's high fives or things aren't going so hot and we need to regroup. We're here for you no matter what. We identify potential crises, their warning signs, and helping them create some coping strategies. Also, just being aware of hotline numbers, and also a very one. I want to say one that seems very obvious is getting medical treatment when you need it, but that's not always. And so this too is where especially when we start working with the client, if they haven't had a medical screening, that becomes really important because some of our clients have had lasting injuries that have gone untreated. All right, when it comes to appearance, we want to encourage clients, and mind you, sometimes you don't really have too much say in what you can wear. But if you do, we want to encourage you to wear shoes that are comfortable, either comfortable to run in or that are easy for you to kick off and run in. If anyone has tried to run in stilettos, it's possible. It's hard, especially trying to run at full speed. In the chat, we have, yes, this is absolutely true. Hard to see things when your mind is conditioned to certain behaviors that seem normal. Difficult to seek help because they don't know who to trust. Absolutely. Trying to avoid things that could be used to choke you or things that would hurt. So, for example, if I'm wearing a scarf, a long necklace, somebody could grab that and could choke me with it. If I'm wearing earrings, that's not going to choke me, but somebody could easily pull those out and that would definitely hurt my ears. Also, when we think about engaging in a sex act, we want to think about either trying to keep clothes on as much as possible or clothes that you could take completely off. So again, thinking about if you have to, like something's about to happen, they're trying to harm you, you need to get out. You don't want, for example, pants to be around your ankles and you can't get out because you're tripping over your pants. So again, that's where you either take things completely off or what you have on, if you need it to run, you're able to. We don't want clothing to be an obstacle of you getting help and support. Also, let me go back here. Also, when it comes to running, if clients, I don't remember if this is on one of the slides coming up, so if not, I want to mention it now. If clients do need to run, when they're on the street, we want to encourage them to run towards traffic rather than away. So for example, cars are coming towards me. So one, ideally, they see me and see me in a panic and somebody stops to help. But also, we live in a day and age of distracted driving. So I want to make sure I could swerve if I need to, if a car doesn't see me. If cars are coming towards me, I don't see any of that. Negotiation. We want to encourage folks to stick, mind you, they might not pick the price list. Price lists might be given to them. Like, this is how much you're charging for this act. This is how much you're charging for this act. But we want to encourage them to stick to that price list and time limit. Because the shorter they're with the person purchasing sex, the better. if they are able to, having some say over the location. Because, for example, if we have somebody who they're going to their hotel room, if you're going to your own hotel room, there's nobody hiding in the closet. There's no weapons hidden or anything like that. If you're going to someone else's house, someone else's hotel room, someone else's car, who knows what's there or who's there as well. Also making sure you have a supply of condoms and lubricant easily available to you. And also doing some condom negotiating skills. And so thinking about things like learning to doing some role play. What happens if somebody offers you more money to not have a condom? That could be really tempting, but again, can carry a lot more risk. Getting money up front. And if you are soliciting on the street, trying to do it at that same location, kind of time after time. That way, again, you build that community with folks who know you. Let's say we have somebody who is soliciting on the street, and we want to think about what are some ways to reduce harm when it comes to just approaching that individual in the car. So we want to encourage folks to approach them from the driver's side as opposed to the passenger side. Because if I'm walking around the car to the driver's side, one, it gives me a chance to kind of scan in the car. Are there weapons in the back seat? Is there maybe somebody hiding under a blanket or something? But two, as I approach the driver, I get a whiff of the driver. So I could tell, is driver intoxicated? Anything like that, where maybe this might not be the safest for me to get in this car. If I'm on the passenger side, I might not be able to smell, kind of that alcohol on breath or something like that. Also, taking down the license plate or pretending to. So let's say you don't have that community. You're by yourself, but there's other people out there also soliciting, where I could just shout out the license plate, blah, 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 blah. Where to the driver thinks people are paying attention to when I come back. Also, when you get in, we looked at earlier how wearing that safety belt is a great harm reduction strategy. Here might not be, because again, what happens if you're in the car, you're driving down the street, maybe you see a weapon. Maybe a person starts talking about some of the things they're wanting to do, and something's just not feeling right. And you need to jump out. You want to be able to do so as fast as possible. And that also comes here, making sure child lock isn't on. And this is a great safety strategy for so many of our clients who aren't even being trafficked, and a great one we could go outside and practice even. How can you, when you get in the car, kind of glance to see is child lock on or is it off? I've also seen and heard from folks when it comes to the car, seeing especially if it's like an older car, if it's like the roll down windows, so like old car, you got to roll down the windows, are those broken off? When you get in the car, maybe even before you sit down in the car, or before you shut the door, I'm sorry, trying to see, can you roll down the window if it's electric, or is the window lock on? So again, you're trying to see, is this safe for me to get in the car? Waving goodbye to someone, even if you don't know anyone. Because if I'm saying, bye, so-and-so, I'll be back in 20. That's telling the driver, people are expecting me back. I just told them your license plate number. You better have me back in 20. When it comes to oral sex, learning how to put on a condom with your mouth. And if you are thinking about that and trying to wonder, how do you do that? The wonderful thing is there are people out there who know how to do that and teach people how to do it. So if that is not you, that is okay. The important thing is to know, who can I get my client connected with? Who could teach them that? Also, at ejaculation, trying to keep pressure on the condom with your lips to prevent any leakage. And afterwards, to gargle with mouthwash. And what we want to discourage, which we want to discourage brushing your teeth or flossing, because that could, just think about, that could open up a wound on your gums. And so if you're continuing to have oral sex, that could increase infection, all of that. So again, if you need to clean out your mouth after, understandable, but gargle instead of brushing and flossing. Some things when it comes to vaginal sex, using birth control and not assuming clients involved in the commercial sex industry, they should know about birth control. For some of our clients, they haven't had any sex education, and the commercial sex industry is not sex education. I've seen this with providers where a client didn't know you're supposed to take the birth control pill daily. And clients like, well, nobody told me. And providers are kind of like, how did you not know? Kind of like, you were in the industry. But again, being exploited and trafficked doesn't mean you've ever received any sex education. Also, keeping your genital area well lubricated, and also wanting to avoid any drying substances, to avoid any tearing or anything like that. If possible, trying to position yourself on top and facing the customer, and as opposed to customer being on top of you. If customer is on top of you and this person is bigger and stronger than you and something you just doesn't feel right, it is way harder to push somebody way larger than you off of you than it is for you to get off them and run. Also, keeping your hand on the base of the penis to keep it hard, and again, to avoid any spillage. And after ejaculation, wanting to remove it immediately. Now, when it comes to anal sex, we want to try to negotiate out of it. There could be more risk here as opposed to oral sex or vaginal sex. One way that folks could do this is putting a price tag on it that makes it seem impossible that anyone would pay for it. And if you are using, or if you are going to engage in anal sex, wanting to encourage folks to use insertive condoms, also known as female condoms, as well as extra lubricants. For our guys who may be engaging in anal sex, it is safer, not safest, safer to be the giver rather than the receiver. Some things about self-defense. Don't carry weapons. If you carry a weapon, no, it can be used against you. One young woman who a lot of her exploitation happened in the hotel room. One of the things she shared that she would do is she would leave her curling iron turned on. So she had a burning hot curling iron if she ever needed to use it. Now, she also acknowledged, I recognize if I ever needed to use it, that person could also turn it on me, and that would hurt. So again, we want, and that becomes that piece with carrying weapons. We want our clients to understand if you carry one, understand the reason, but also know that person might also end up using it against you. Using your voice and speed. So if you are running, making sure people know you need help. Also, this is where things like maybe a self-defense class can come into play. And this could also be great engagement that we could do with them. Knowing what areas of the body to, not necessarily, like you're not trying to kill the person, but what areas of the body are kind of your targets where you're going to get a head start. Again, running against traffic as opposed to towards it. And just sharing and being in community. With that, there's a couple of extra slides here when it comes to harm reduction, but I want to be respectful of time. So you're going to have these as a reference. We covered the big ones, and the other ones are more so just for when folks get out of the industry. Want just to talk about self-care for a moment, and also just want to open it up if there are any last-minute questions or thoughts. I'm going to start talking about self-care, but if you do have any, please feel free to interrupt me. All right. So again, we started off here and we are ending here. As we think about doing this work and doing hard work with folks who are experiencing and have experienced a lot of trauma, and given where they're at in life, they might not be ready to make a change and leave it. That again is where it can take a toll on us. And that's where it's important that we are taking care of ourselves so we are able to hold hope for them. We are able to convey to them, you are a worthy human being wherever you are on your journey. And it's hard to do those things if I'm constantly going into work from a place of depletion, let alone the toll it takes, on my personal life. So definitely want to just reiterate and encourage us to make sure we are taking care of us. Want to thank everyone for joining today and for being here. Want to thank you first and foremost for the great work you are doing with folks who are at risk of being trafficked, as well as who have been trafficked, as it is so important that we continue to support them. So thank you. And Ash, I will hand it back over to you.
Thank you so much, Nicole, for sharing your time and your expertise, all the great information. Thank you so much. We really appreciate learning all these new tools. Hopefully everybody was able to grab something from today. Before we officially close out, I would like to add the evaluation survey into the chat. If you're able to just take a couple minutes and fill that out, it would really help our CVCA trainings and have more opportunities in the future. So thank you so much for being here and all the important work that you all do. Please do self-care after this meeting. But if there's no other questions, the meeting will come to an end. I will also send the evaluation survey to everybody in an email as well if you don't have the time to work on it right now. I totally understand. Also, here are socials. If you want to follow us on our website, YouTube, and our LinkedIn. If you want to ask any questions to Nicole, feel free to stay back. If not, have a great rest of your day. Thank you.